Hi, I am Kristen and I'm a pregnancy coach that works with mamas all over the world. I help you go from feeling anxious and overwhelmed to really enjoying your pregnancy, preparing for a sacred natural birth, and giving your baby the beautiful beginning that you are dreaming of. Today, I want to talk about having a healthy pregnancy over 35. You may have seen in your obstetrician's office where it's written down that you are a geriatric mother because you're over 35. And I think that that is the most ridiculous term ever. Not only because it's ridiculous to call a woman who is 35 years young geriatric, but because it's ridiculous in how it makes you feel about yourself and your pregnancy. The reality is that you can have a healthy pregnancy with great outcomes just like a younger mom. There are some legitimate concerns for moms over 35, but those may not necessarily be related to your age more than they are related to lifestyle factors. Now, there are a few things we know, like it's more likely that there will be chromosomal abnormalities and that sort of thing. That's related to the age of your eggs, and also it can be related to your partner's sperm. Those are things that we can't really help, but what you can do is make sure that your body is as healthy as possible for your baby. One thing that is of concern for older moms is increased insulin sensitivity. This is one of the things that I was talking about that is more related to the fact that you are just an older adult overall than necessarily you're an older pregnant woman. Insulin sensitivity is something that happens to everybody as they get older because the body is just less likely to be able to handle the sugar and carbohydrate onrush that it's getting hit with year after year after year in our modern diet. So understanding what insulin sensitivity is, and especially how you eat for that when you're pregnant, is really important. If you think about typical responses to insulin sensitivity in the general population, those solutions may not be appropriate when you're pregnant because a lot of times they have a good effect of you losing weight, right? But you end up eating fewer calories. You may still get a lot of nutrient density, but you want to understand insulin sensitivity in the context of pregnancy so that you make sure that you're still getting the appropriate number of calories, the right amount of protein, and all of the macro and micronutrients that you need. So insulin sensitivity is something to pay attention to, and that is something that's more likely to be relevant to you as an older mom. It's also true that the possibility of complications in pregnancy and childbirth go up slightly. The thing that is really interesting about this, and I also find really encouraging, however, is even though the rates are up slightly, the true thing that seems to make a difference in empirical studies about older moms is that the place of birth is the biggest determinant. So what that means, at least in the studies that have been done, is, for example, moms who were planning a home birth without any interventions were much more likely to have that. So moms of the same age, say a 36-year-old mom and a 36-year-old mom, home birth, hospital birth. The hospital birth mom was much more likely to have complications and interventions needed. Now, that doesn't mean that you have to have a home birth. What that should tell you is that it isn't because of the mom's age. It's because of the way that things are being handled, the way she's being treated, perhaps assumptions that are being made. Those are all things that you can pay attention to and that you can work with when you have that knowledge and when you know that, yes, there's going to be a slight increase, for example, say in the risk of needing a cesarean for you and your baby, but it's not a huge jump that it may look like at first. It's something that if you, just like a younger mom, do the work throughout pregnancy to stay healthy and low risk, you are very likely to be able to have a healthy pregnancy and a beautiful birth, just like you're hoping for. Now, another thing that I want you to think about is that being an older mom can actually have advantages. For example, we know that breastfeeding success rates for older moms are usually better. That might be because older moms also tend to be college educated and understand more the benefits of breastfeeding for the baby. Oftentimes, as an older mom, you have advantages in that you're more financially stable or even more affluent, and you have more resources. You have a stable job where you can take more time off, where you may be able to bring baby to work with you, or where you have plenty of time to pump. So there are some advantages that older moms have that younger moms don't. Now, that doesn't mean that moms of any age won't be able to breastfeed. I had my first baby when I was a teenager, and I breastfed her, and I breastfed all of my babies up through my 8th, who was born when I was a geriatric mom. So You can have a good birth and a good breastfeeding experience no matter what age you are. But if you are a mom who's having a baby at 35 or 40 or even older, I want to encourage you that you can have a healthy pregnancy, that you can have a beautiful birth experience, and that you can enjoy postpartum and mothering your mom with some beautiful and specific advantages that you bring to your baby because of your life stage. Now, if you're still listening to this, I know that you are a mom who cares about your baby and your pregnancy and you want more information. Maybe you're going, okay, Kristen, I understand what you're saying, but what do I do to stay low risk? What do I do to help prevent things like insulin resistance and help it so that I don't become one of those statistics? This is what I love to do with moms. I work with moms all over the world as a pregnancy coach, offering support in those practical ways, helping you create a diet that is customized for your lifestyle, for what you like to eat, and is easy and fits into your world and helps you nourish your baby. And I help you with things like coming up with a birth plan, giving you evidence-based information so that you can make decisions that are right for you and your baby, based not on statistical categories or theoretical risks, but based on what evidence actually says and where you are in your life and your pregnancy. With my coaching clients, I'm chatting with them frequently via Zoom so that I'm with you, there's continuity there, and we're able to talk regularly about what's going on with you. I also offer text support, so you can text me a question or even shoot me a voice text if you need to rant about something or if you just have a lot on your mind and need to speak that out. I'm there for you. If that level of support resonates with you, I would love to talk with you about my pregnancy coaching program. Head over to birthbabylife.com/beautiful. Let's get on the phone and talk about how I can support you this week.